The last 14 days, even the last 7 days, have started to give a more confusing picture. We have seen a less resilient decline in the infections. The picture we have seen has been almost that we can call a stalemate, where there is no serious decline, and yet we can't say there's any worrying rise in infection. Instead of the curve flattening, as we always say that we're striving to flatten the curve, this time the curve has been just on a plateau, no rise, no decline.
We are close to the end of the wave threshold, but we've seen a slower down wave compared to the up wave. And just now in the last week, we're seeing increases in admissions in Gauteng, Limpopo, Mpumalanga. It's mainly children, probably because they've gone back to school, and then the spill over to the parents who are at home in the 20 to 40 year age group. So we've seen some admissions in those age groups. But certainly we continue to see the decoupling of cases, admissions, and deaths in the fourth wave. And the hospital capacity was not breached at all, despite no increases in national restrictions in the fourth wave. We saw no strain on bed capacity, oxygen, and critical care beds.
We do have now a lot of immunity in the population, largely from natural infection, some due to vaccination too. And in either case, it does seem to prevent at least the majority of severe disease. So that's an important thing, and that's probably the main reason why we've seen an uncoupling of the cases from severities. We've seen a lot of cases in the fourth wave, but not the same degree of severity.
It is expected that by the end of February, we should be able to reach 5% of positivity, as I've indicated, that once the schools now are settled, movement is settled, movement of people, we expect the continuing of the downward trend. But there is also expectation that as we get closer to winter, we'll get closer to the fifth wave. That the fifth wave is likely to break as we get closer to winter. Of course, it may even come closer earlier, depending on whether we experience variants of concern much earlier than we did with the Omicron.